Hi viewers, this is Dr. Iftikhar Aslam from Pakistan. Today I'm going to present my lecture on a veterinary disease called as mammalian chlamydiosis, which not only hits the animals but also the humans. So it is having a lot of importance. So let's move forward. In today's lecture, we'll cover the information regarding the organism that causes chlamydiosis and its epidemiology. We'll also talk about how it is transmitted, the species it affects, including humans, and the clinical and necropsy signs observed. Finally, we will address the prevention and control measures as well as the actions to take if the chlamydiosis is suspected. The zoonotic Chlamydia with reservoirs in mammals are the members of the family Chlamydiaceae, an unusual group of obligate intracellular bacteria. The members of this family are considered to be gram-negative due to their relationship with the other gram-negative bacteria, but are difficult to stain with gram stain. They cycle through two forms: a metabolically inert, ineffective elementary body and a metabolically active reticulate body found only inside the cells. Until recently, the Chlamydiaceae contained only a few species. However, this family has been recognized based on analysis of ribosomal RNA. A new genus, Chlamydophila, was established. Some species were renamed and some strains were assigned to new species. Both Chlamydia species and Chlamydophilia species cause disease called as chlamydiosis. Some of the organisms that cause chlamydiosis are zoonotic. Chlamydophila psittaci, formerly called as Chlamydia psittaci avian strains, is found in birds and causes psittacosis or avian chlamydiosis. The zoonotic mammalian species that are described here are Chlamydophila abortus, formerly called as Chlamydia psittaci mammalian abortion strains or serotype 1. The number 2 is Chlamydiophila felis, formerly called as Chlamydia psittaci feline strains. Chlamydia pneumoniae, formerly called as Chlamydia pneumonia. Chlamydia felis and Chlamydia pneumonia occur worldwide, while Chlamydia abortus has been reported from most sheep raising countries but is not found in Australia or New Zealand. Chlamydophila abortus often affects sheep and goats and occasionally deer or cattle. This species has also been reported from a rabbit, a horse, guinea pigs, mice, green sea turtles, and the snakes. Chlamydophila felis is normally found in cats. It has also been reported from iguanas. Chlamydophila pneumonia was until recently thought to affect only humans. Since the 1990s, this species has been found in horse, dogs, koalas, rats, iguanas, and frogs. Pregnant ruminants shed large number of Chlamydophila abortus in the placenta and uterine discharges when they abort or give birth. Many infections occur by ingestion, but aerosol transmission is also possible, and recent research suggests that venereal transmission may be important. In addition, the Chlamydophila abortus can be found in the feces and the urine of some ruminants as well as in the goat's milk. Both sheep and goats can be chronic carriers. Chlamydophila felis is shed in ocular or nasal discharges. It has also been recovered from the various internal organs. Persistent infection of the oviduct has been reported, suggesting the venereal transmission may be possible. The method of transmission for Chlamydophila pneumonia in animals is unknown. In koalas, and the Chlamydophila pneumonia has been isolated from the respiratory tract, the eye, and the urogenital tract. In horses, the species has been found only in respiratory tract. In cats, conjunctivitis due to Chlamydophila phallus is appearing in approximately 3 to 10 days. The symptoms often begin in one eye but eventually becomes bilateral. They typically include blepharospasm, chemosis, congestion, and ocular discharge that may become purulent. Fever usually begins several days after the onset of the ocular signs. The symptoms are generally most severe during the second week of the disease and subside over the next 2 to 3 weeks. However, they can persist for a long time in some cats. The complications may include vascular keratitis, corneal ulcers, pannus, and corneal scarring. Some cats also develop mild to moderate rhinitis with serious nasal discharge and sneezing. Pneumonitis is occasionally seen, and in single case, a chlamydia species was recovered from a cat with peritonitis. Chlamydophila abortus causes outbreaks of abortions, zoonotic abortions in sheep and goats. Sheep and goats infected early in gestation abort late in the same gestation, but animals infected late in gestation usually abort late in the following pregnancy. Congenitally infected lambs and kids may abort their first pregnancy. Chlamydiosis can be diagnosed by identifying the organisms or the antigens in the tissue scrapings, tissue sections, and secretions. Chlamydia can be stained with the Giemsa, Brucella differential, and modified Ziehl-Neelsen stains, immunofluorescent or immunoperoxidase staining, and enzyme-linked immunosorbent assay can detect the chlamydial antigens. Most of the tests can identify the organisms only as members of Chlamydiaceae. They generally cannot identify the species. Chlamydia can also be isolated in the embryonated chicken eggs or cell cultures including McCoy, BGM, and baby hamster kidney cells. In many cases, serologic tests for chlamydia are not species specific. Complement fixation is used most often in aborting ruminants, particularly as a herd test. Chlamydiosis is usually treated with tetracyclines. Other antibiotics including erythromycin and other macrolides, tylosin, quinolones, and chloramphenicol may also be used. Ruminants can carry Ruminants can carry Chlamydophila abortus asymptomatically, and in zoonotics, abortion is often introduced into a flock in new animals. Replacement stock should be bought from the sources known to be free of the disease. Sick cats, aborting ruminants, and other animals with chlamydiosis should be isolated. Personal hygiene, including hand washing and cleansing, disinfection of footwear, is important to prevent spreading of the infection between the animals. Affected animals should be kept isolated for approximately 3 weeks. A live vaccine has been reported to decrease the shedding of the Chlamydophila abortus in sheep and may be useful for eradication programs. It is not available for all countries. Treatment with tetracyclines can prevent abortion in ruminants, but organisms may still be shed at the birth. Well, with this, we are going to end our today's lecture. Thank you for watching this video.